Is our Director of Public Benefits here at Rothkopf. We love Caitlin, and thank you so much for agreeing to do this.
Don't thank me too soon. Don't thank me too early.
It's all good.
All right. Thank you, Donna. Thank you guys for having me, and thank you all for joining me today. Like Donna said, I'm the Director of Public Benefits for Rothkopf. I work with an amazing team, and we guide people through the very confusing and difficult Medicaid application process and also the Veterans Benefits application process. And then we also do a little bit of health insurance advocacy as well. So today we are going to discuss the most recent changes to your public benefits. Some things to keep in mind. I am going to go through all of the 2021 numbers and kind of what they mean, but I'm also going to discuss some recent policy changes, some recent things that I've noticed since COVID kind of started and since the government has been reacting to that. And a lot of these things are kind of, subjective things that I've noticed. So I'm interested to see what other people who deal with these programs have noticed as well. So the first thing we're going to discuss today is going to be Medicare. There haven't been any enormous changes in 2021. The Medicare that we're talking about is going to be health insurance that people who are age 65 plus typically enroll in. What we're going to be discussing a lot is going to be original Medicare. So original Medicare consists of those parts A and B. Part A is going to be your inpatient services, such as hospital visits. Part B is going to be your outpatient services. So that portion of your Medicare is going to cover doctor's visits. You'll also sometimes hear people refer to Medicare Part C. That is going to be Medicare Advantage. Medicare Advantage are privately managed Medicare options for people. So people who don't want to go with their government managed Medicare can also enroll in a private Medicare option, and that's going to be Medicare Advantage. You're also going to hear people reference Medicare Part D as well. Medicare Part D is going to be prescription coverage. That's another add-on to Medicare. So we're going to talk about the numbers first. Do keep in mind that these numbers are for people who have original Medicare. So if you have a supplement on top of your Medicare, these numbers are going to vary. And if you have Medicare Advantage, these numbers are going to be totally different because they're going to be managed by the organization that manages your Medicare Advantage plan. So the first couple are going to be your premium. This is for your Part B. Part A is generally free for most people. Your Part B deductible, your Part A deductible. And you're also going to see the co-pays for hospital stays and skilled nursing have gone up as well. But like I said, these are all for people who just have original Medicare. A Medicare supplement is going to bring these costs down, and a Medicare Advantage plan is going to be different as well. So I'll leave these up just so you can see them for a second. And then I'm also wanted to go over some things that I have noticed, some changes that I've seen take place in the last year or so. You still have your same options for Medicare. Your first option is going to be that original or traditional Medicare, and that's going to encompass your Part A and your Part B. Typically, Part A and B together cover 80% of medical services. And then the other option is going to be if you want to add on a supplement or a Medigap. A supplement typically picks up the remaining 20% that Medicare doesn't pick up on its own. You can also add on that Part D for prescriptions as well. So all of those things together are going to add up. I mean, this is going to be the most expensive option, having traditional Medicare plus a supplement plus Part D, because there are premiums for your supplement and a premium for a Part D. Generally, for the people I work with, while this is the more expensive option, usually in like the $300 to $350 range monthly, it's going to be the option that I recommend most often, because it is sometimes hard to get into these supplemental plans once you're older. It can be good to enroll in one right when you turn 65, and they're not going to go through that underwriting and ask you health questions. So I typically tell people when they're 65, if they can afford the higher premium, to go ahead and go with this option. You're going to have a wider network of providers that you can go to. And it's a good long-term solution. As you age, as you require long-term care, as you need to see more specialists and more doctors, it's going to save you money because you won't be paying as much out of pocket for those doctors. Another option is Medicare Advantage or Part C. This is going to bundle your A and B together into kind of one benefit. A lot of times Medicare Advantage includes a Part D, so it includes prescription coverage, and they oftentimes have a lot of extra services like dental and vision. This option can be it can make people really interested because it is usually a lower monthly premium. So people on Medicare Advantage plans generally pay, I have some people that pay nothing on a monthly premium, and I have some people that pay like $140 per month, depending on what plan they're enrolled with. But a lot of times I don't tell people to go for this option because you're gonna have a smaller network of providers that you can work with. And as you age, as you need long-term care, as you need more and more coverage, those costs can really add up. Another option, when you turn 65, you can enroll in Medicare Part A only. This is attractive to some people because there's no premium for Medicare Part A only, and they don't want to deal with paying that Part B premium, that $148.50 that we talked about earlier that comes out of your Social Security. That does save you money initially to not enroll in B and to only take A, but same thing, long-term, you're gonna wish you had that Part B coverage. You're gonna wish that you had something covering 80% of your doctor's visits. And also too, the longer you wait to enroll in Part B, there can be a penalty on the premium. So your premium can go up and up and up the longer you wait to enroll if you don't have any other coverage. Some people have coverage through a former employer or coverage through an active employer that constitutes creditable coverage. But if you don't have something else, I usually recommend that people get right into a Part B as soon as they turn 65. Another change that I've seen actually impact people this year, Medicare has made some changes to their special enrollment periods, or SEP. So if you want to drop, add, or change your coverage, typically you can only do that during special times of the year. So you can only do it during open enrollment or when you first enroll in Medicare at age 65. There are some special enrollment periods that you can use to drop, add, or change coverage whenever you need to. So some of these usually are going to be life changes, like moving between states, moving to a different zip code that your plan is no longer active in, entering a long-term care facility is one, and being approved for Medicaid is also another one. So if you fall into any of those categories, you always have a special enrollment period. So you can drop, add, and change your coverage anytime. One of those special enrollment periods is if you're an extra help beneficiary. So extra help, you automatically get extra help when you're approved for Medicaid, but other people can be enrolled with extra help through things like SLIMB, QIMB, the low income subsidy. These are programs that help to pay for your Medicare premiums. So your Part B and your Part D. If you have a very low income, you can apply for extra help and the government will help you pay for those premiums. If you are an extra help beneficiary, that is also a special enrollment period. So if you fall into this category, it used to be that you could change your coverage anytime. They've recently changed it so that you can only use this special enrollment period to change once per calendar quarter in the first 3 quarters of each year. So that's going to be January through March, April through June, and July through September. So I have seen this come up for some people when they're trying to switch between their Part Ds, their prescription insurance. I have seen them get more pushback from the health insurance companies because they are monitoring how often people are using this extra help special enrollment period. And I have had a couple people get declined that I had to go back and redo the application for them. So it's just something to keep in mind. If you are trying to change your Part D more often, you might want to use one of those other special enrollment periods that isn't as limiting. And the last thing I like to bring up is special needs plans for dual eligibles. Those are also known as SNP plans. So special needs plans are for people who are only dual eligible. So people who are enrolled in both Medicare and Medicaid at the same time. These people generally, for some people, these are good plans. They bundle all of your insurances together. A lot of times they offer special little add-ons, like a nurse practitioner that comes into the facility every once in a while to check on your loved one. And for some people, that's very attractive. But these plans do have a tendency to advertise to long-term care residents. So oftentimes I see some of my residents who are approving these plans, approving their switch to these plans because somebody actually came into their facility, called them at the facility and was kind of fishing for someone to enroll. And oftentimes they go ahead and okay this without having the full information and without their family having all of the information they need to make this kind of big change for them. Some of these plans are good for people. I mean, for someone who resides in a nursing home, who doesn't really use any providers outside of that nursing home, and who generally is going to stay there for the rest of their lifetime, a special needs plan can be really advantageous. But for someone who maybe goes out to see a lot of specialists, who switches between facilities often, who isn't settled in permanently, or for someone who has a family doctor that they've been using for years that they really like, they might not be in network anymore if they switch to one of these special needs plans. It usually is a very small limited network, and a lot of them are specific just to the facility in which they reside. So it's really important for people to know all about this before they okay these plans, especially because I see so many of them advertising to residents directly, and often the resident says it's okay before the family or our office even knows what's going on. So it's just something to watch out for. So I'm finished with our Medicare section. If there are any Medicare questions, we can do that now. Otherwise, I'm going to go ahead right on to everyone's favorite Medicaid, everyone's favorite public benefit.
You can feel free if you want to just put your questions in the chat. Caitlin, we don't have any questions in the chat as of right now.
Awesome.
Or if you are more comfortable with just unmuting yourself, this is Zoom, you do have the capability. I know Caitlin really wanted to have the openness of conversation if you guys needed a little more explanation. We do have one question that just came in, Caitlin, and it was, oh, we have a couple that are popping up. Great, see, my stalling helped you guys type. When should you apply for Medicaid?
For Medicare, I think it's Medicare. Yeah, sorry, Medicaid's on the screen. It's very confusing. So Medicare, you can apply either during the month that you turn 65. You can apply the 2 months prior or the 2 months after you turn 65. So you have a 5-month window to apply for Medicare. If you're already enrolled in and receiving Social Security, when you turn 65, your Medicare will automatically kick in. If you've had other creditable coverage after 65 and you didn't enroll, like you had coverage through an employer or a former employer or a retiree plan, as soon as you lose that coverage, I would recommend applying for Medicare, because the longer you wait and don't have that coverage, the more likely you are to end up with some sort of enrollment penalty.
Another question is Medicare going to continue to pay for telehealth for doctors and mental health?
As far as I know, I haven't seen any changes to that. So as far as I know, they're going to continue to cover it as they have been.
And we have some acronyms here, so forgive me if I don't know what this is, but a SNP, I'm sure you know what that is, Caitlin. A special needs plan.
Mm-hmm.
Would a managed plan offered through a facility be an example of a special needs plan?
Yes.
Okay.
Yep.
And can I use Medicare with my company insurance for an operation?
Yes. So if you have health insurance through your work, you can actually still take Medicare. They just take a different order of payment. So if you enroll in Medicare and one of these supplemental insurances, Medicare pays first and then your supplement. If you have insurance through an employer, it would be your employer insurance would pay first and then Medicare.
And lastly, and then we're going to move on to our next topic to allow time for all three. Can you opt out of Medicare if you have an alternative private insurance plan?
Yep. You can opt out of Medicare. You can wait to enroll until you're ready. You won't get any of those late enrollment penalties that I was talking about if you have creditable coverage through an employer. So if you have coverage that is as good as or better than Medicare, then it's considered creditable coverage. I usually tell people to check with their HR to make sure that it's creditable, especially prescription insurance, because you can also get a Part D late enrollment penalty if you have no prescription coverage. So you can always check with your HR to be sure, but yes, you can wait to take Medicare if you have creditable coverage through an employer.
Wonderful. Guys, I'm going to ask Caitlin to move on to the next subject of Medicaid, just because I know we only have an hour to cover all of this content, and I do want to allow for Q&A in between each session.
Okay.
We are posting contact information for the firm and also directly to Caitlin's email. So if you did have any additional questions, please feel free to shoot them over to us and we'll get them to Caitlin. COBRA doesn't count, right? One of our own team members wanted to know that.
I know, I saw that, Jacinda. I don't believe so.
Keeping you on your toes, Katie, that's all.
I know, right? Thanks a lot. All right, moving. So the Medicaid we're going to talk about today that our office encounters most often is going to be long-term care Medicaid. So there are a couple different types of Medicaid. We are most often dealing with long-term care Medicaid. So that means Medicaid that is going to cover different types of long-term care. We apply for Medicaid in both Pennsylvania and New Jersey in our office. In Pennsylvania, Medicaid is going to cover your nursing home and home care. In New Jersey, they will cover nursing home, home care, and assisted living care as well. That is what we're talking about today. So your 2021 Medicaid numbers to be aware of. The first two are your minimum and maximum CESRAs. CESRA stands for Community Spouse Resource Allowance. The Community Spouse Resource Allowance is for applicants who are applying as a couple. So a husband and wife, one person is applying for Medicaid, the other person is continuing to reside in the community. Generally, for married couples, the healthy spouse can keep 50% of the assets, and that remaining 50% has to be spent down in some manner in order to achieve Medicaid eligibility. The healthy spouse can keep 50% of these assets with a maximum of $130,000. So they cannot keep more than $130,000, even if 50% of their assets is higher. And they can't force them to spend down lower than this $26,076. This is, this varies depending on the couple's situation. And also, like I said, depending on the circumstances, sometimes our office can figure out other ways to gain Medicaid eligibility without them having to spend down that other 50%. But these numbers change every year with the cost of living. Next, we're going to see our minimum and maximum MIMNAs. This stands for Monthly Maintenance Needs Allowance. These numbers are there are ways for the community spouse to protect as much income as possible. So in a circumstance where the community spouse, the spouse still residing at home, their income is much lower than the Medicaid spouse, the spouse applying for Medicaid, this is a way that the healthy spouse can keep some of the Medicaid spouse's income. So something to keep in mind too, these numbers are inclusive of the community spouse's own income. So in order to calculate about how much they would get to keep out of the Medicaid spouse's income, you would take this $3259.50 and subtract out the community spouse's existing income. So if they're already receiving Social Security, they're not going to get $3259 plus the Social Security. It's inclusive of that number. And then we've also got the income cap for this year. So generally, this is the amount of money that someone can have in order, the amount of income that someone can have in order to qualify for Medicaid benefits. As we know, there are often much more complex systems in place. So it's not just a black and white situation. This income cap in New Jersey, if you're applying for Medicaid and your income is higher than this $2382, there are some systems in place to still apply. This is where qualified income trusts or QITs come in order to attain eligibility. That's something that our office gives a lot of clients guidance on because it can become very complicated. In Pennsylvania, if you're applying for Medicaid, if your income is above this $2382, you can only keep $2,400 in assets in order to be eligible for Medicaid. If your income is lower than this $2382, you can keep $8,000 in order to be eligible for Medicaid. So this income cap kind of dictates in Pennsylvania how much your assets can be in order to apply. In New Jersey, it just kind of dictates what you need to do in order to apply. So if you need to open one of these trusts in order to gain eligibility. The next two numbers we're going to talk about are going to be the Pennsylvania and New Jersey penalty divisors. These numbers are based off of the average cost of care, the daily rates in both Pennsylvania and New Jersey at long-term care facilities. When we're talking about penalties, we're talking about the 5-year look back, which probably many of you have heard referenced. The 5-year look back is part of the application process. When you submit a Medicaid application, the assigned caseworker goes through 5 years worth of financial records. So they want to see every single transaction that you've made in the last 5 years. If they determine that you have made any gifting, any transfers for less than fair market value, they can take that total amount and they can say that you are in a Medicaid penalty. So they'll say you've been approved for Medicaid, you've met all other eligibility requirements. However, because you transferred these funds, we're going to tell you you have a period of ineligibility where we will not pay for your long-term care. So, for example, in Pennsylvania, you've transferred $11,000 to one of your kids as a gift for their wedding. That is going to create a 1-month penalty during which Medicaid won't pay for your long-term care. Okay, and then these are just some changes that myself and the rest of my team have noticed this year, some things that we've been dealing with as we go through the Medicaid application process with clients that I've noticed have been a little different this year, and also especially since a lot of the different COVID restrictions have been in place. The first thing that we've noticed is the 45-day processing time. So as long as I've been doing Medicaid applications, caseworkers have been limited to a 45-day processing time. So from the time that you submit a Medicaid application and they receive it, they are supposed to issue some sort of determination, whether that be an approval or denial, within 45 days. Generally, prior to COVID, our office was noticing if there were missing items in a Medicaid application, if the caseworker found bank accounts that needed more information, they were pretty willing about giving us some sort of extension in order to get these documents. But we've noticed they're sticking to this 45 days much harder than they used to. So in order to get approved for Medicaid, it's become more important than ever to submit a complete application, to have as many documents together as you can before sending in the application, because they are really sticking to this 45 days. Another change that we've noticed are going to be in the functional eligibility determination or pre-admission screen. The FED is the Pennsylvania version and the PASS is the New Jersey version. These are going to be your clinical eligibility determinations for Medicaid. In order to be Medicaid eligible, you also need to have approval clinically. So because neither state is doing in-person assessments at this point, they are supposed to date the paperwork for both of these clinical screens for the time period that you've requested the clinical screen. But then they're not actually doing the clinical screens. So we've found that a lot of this paperwork either isn't getting done in a timely fashion, or it's being misplaced, or it's not getting into the computer system. And so the Medicaid caseworker can't see it. So it's causing a delay in processing. We have just noticed that we have to be much more vigilant as far as making sure that this piece is in place. It's especially important in New Jersey because New Jersey uses the clinical eligibility as part of their determination in an eligibility date. So if they can't find this paperwork in their system, they're going to either deny the application or keep pushing the eligibility date to the date that the pass is done or the clinical eligibility is completed. So this is just something to keep in mind. It's not as easy as it used to be. There are also COVID restrictions right now on terminating a Medicaid recipient. So if you're already receiving Medicaid, it's much harder right now to get terminated, which is good for most people. If you're a little late in submitting your renewal every year that you have to do, you're not going to get terminated. You can contact the caseworker, you can tell them you're working on it, and it's not a big deal. But if you're trying to engage in some sort of planning where you need the applicant to be terminated, like for example, we have some clients who receive an inheritance and we need them to spend that money down. We need to submit a new application. We need to do some planning with that inheritance. Getting the original application terminated is an important part of that process. And so it has caused some issues and some delays that we've seen. The accessibility of caseworkers has changed significantly as well. They're not in the office every day. So we're seeing mail getting turned away and coming back. We've sent some FedExes to some different counties that won't accept them because they don't have enough staff to physically review the application when it arrives. They're encouraging people to do the majority of their interaction with the county via email. So if you don't have that caseworker's specific email, it can be a little bit difficult to communicate with them at this point because they're not in the office, they're not answering their phones. So we've definitely had to push email a little bit more. And if you are somebody who has done a Medicaid application before, you know that it's very rare to get paperwork back from the county with an email address on it. So what we've done is we've started to compile as many email addresses as we can get our hands on and save them, so that when a caseworker is assigned, we try to reach out to them via email initially to make contact, to make sure that they're getting all of the information we're sending them. A lot of counties too have main inboxes for their Medicaid departments. So you can actually CC that main inbox. And a lot of counties will send like an auto reply saying they got your email. So that's another way to kind of timestamp your delivery. And then home care trends. We're definitely all seeing more of an upward trend in home care. I think people are a little bit more skittish to institutionalize their family members because of COVID. But on the positive side of that, we're seeing a lot more hours of care being granted. We're seeing more flexibility by the MCOs in granting those hours. And we've also had a lot of clients who have recently been pretty successful in appealing and getting more hours. We still, though, see the same issues with private home care agencies not wanting to participate because they don't get that same reimbursement from Medicaid as they would via private pay. So it can be a little bit more difficult if you want to utilize a private home care agency through Medicaid. And then we're still seeing CHC continue to infiltrate and continue to kind of naturally become a part of the Medicaid application process. Community health choices is when Pennsylvania started utilizing private health insurance companies to manage their Medicaid programs. So this is fairly new, I would say in the last 2 years. I think it was the end of 2018 or beginning of 2019 that it came into effect in southeastern Pennsylvania. So this at the beginning was a little bit more difficult because you had to coordinate between Maximus, between the county assistance office, between the MCO. But we've seen that we're seeing okay results with hours. We're seeing okay results with communication. We just have to make sure that all of these different organizations are communicating with each other, especially with Maximus. And the MCO now involved, they want to be more heavily involved in the clinical application process and the financial application process than they need to be as far as Medicaid goes. So we usually kind of have to just, introduce ourselves, make sure that they know that we're handling the financial portion, and just keep an eye on things to make sure all of these different organizations are communicating properly. Okay. So next, we're going to move on to veterans benefits.
Caitlin?
Yeah.
We've been queuing up some questions, actually. If we could take a couple of minutes
Awesome.
just to open up the chat for anyone to enter any additional questions. I'm going to start reading off some of the ones that we've already been pulling for you. One of the questions was, can you discuss irrevocable burial reserve requirements for Medicaid? And is that something that you feel comfortable discussing?
Yeah. So one great way to spend down your resources for Medicaid eligibility is to purchase an irrevocable prepaid burial. You can go through pretty much any funeral home of your choosing. And as long as you tell them that you are going to be applying for Medicaid or you're on Medicaid, they should know the requirements. It's an irrevocable burial reserve. So that means that you're going to put funds into this account and they're not going to be touched until this person passes away, and they're only to be used for funeral expenses. In Pennsylvania, there are specific limits depending on what county you reside in of what the maximum you can put into this burial reserve is. It's like you generally ranges between I would say $12,000 and $16,000 per county, but depending on what county you're applying for Medicaid, there's actually a spreadsheet of what the maximum is in each county. But generally they just put it into this burial reserve. It's irrevocable, you can't pull it back out. And it's a great way to preserve some assets for your burial, and it won't be counted towards your total assets for Medicaid purposes.
Thank you. The next question was, and I didn't get a clarity, so I'm going to read it as written. Knowing each person's financial situations are different, and that Medicare, IRS, and the VA have different thresholds and look-back periods. Where and how does one start to develop an asset protection and spend-down plan to qualify for Medicare? I questioned if that should have been Medicaid.
Yeah, I would guess it's probably supposed to say Medicaid.
Yeah. Could you answer do you want me to read it again with the Oh, he said he's still learning between Medicare and Medicaid and the difference. So probably makes more sense for that question with Medicaid.
I know, 2 totally different programs, 2 very similar names. They want us to all be confused all the time. It's important.
So to go back to that question, where and how does one start to develop an asset protection and spend down plan to qualify for Medicaid? Where do they begin? Calling our office?
Yeah, by calling Rothkopf, by calling the elder care attorney of your choosing. In general, I would say most people that apply for Medicaid on their own do end up spending that more than they need to on care before they realize that they need to engage in some sort of planning. When someone comes into our office, one of the attorneys will meet with them. They'll go through their financial situation and they'll determine whether, we're close to Medicaid and there's really no point in engaging in planning, and we'll handle the application for them. Or some people do have significant assets and we want to preserve as much as possible for the healthy spouse, because, they might have to live in their home in the community for another 25 years. And we want to make sure that there's enough money for them, that they can continue to do that in the way that they're accustomed to. So a lot of times we will purposely engage in like a gift plan where we purposely gift assets. Sometimes we will engage in some sort of Medicaid compliant annuity purchase, and we'll help to facilitate that as well. So it just really depends on the situation. But I would say most of this stuff, especially if you're going to do a gift plan, it's really very specific. You really have to be careful with how you structure that, because you want to make sure there are enough assets to pay through any penalty. And you also, same with an annuity, you kind of need to have somebody you trust to purchase that annuity to calculate it for you. So generally those types of planning, yeah, find an elder law attorney of your choosing.
Another question we have, it's a two-part question. In PA, if you accept Medicaid to pay a family member to care for you, does Medicaid put a lien on your home upon your death to reimburse for those expended funds? And the same question goes, does this also apply to New Jersey as well?
So in both states, there is something called estate recovery. So estate recovery it's a division of the government that after someone who passes away while they were receiving Medicaid benefits, the government comes back and says, okay, during this time period that you were on Medicaid, we paid out $130,000 for you, or however much money that we paid out for your medical expenses during the time you were on Medicaid. And they're allowed to attempt to recover this amount from your estate, however they want to do so. But they really can only recover actual assets. So they can't recover a house, they can't recover anything that's not a physical asset, and they can only recover up to what you had on your date of death. So oftentimes when we're applying for Medicaid for someone, we'll transfer the home, we'll do some sort of planning with the home so that there's not a lien. But generally, if someone passes away while receiving Medicaid and they have a home in their name that's still deeded to them, Medicaid can place a lien on that home, but they can only collect on that lien when the home sells. So if someone's going to continue to reside there indefinitely and they're not planning on selling that property, it's really not an issue.
Thank you. Are there Medicare friendly annuities?
I'm guessing Medicaid.
Yeah,
Maybe Medicaid
as well.
But yeah, that's one of the big tools we use, especially when we're applying for Medicaid for a married couple and we want one of the spouses to preserve as much assets as possible. We do a lot of Medicaid compliant annuities. The government is very strict about what type of Medicaid annuity, what type of annuity you can use that will be allowable for Medicaid. Generally, the types of annuities we use are the types of annuities you would never purchase otherwise unless you're applying for Medicaid. So they're irrevocable, they can never be undone. They're not assignable, so you can't transfer ownership to someone else. They offer, all the payments are the same, and it has to be actuarially sound. So you can't, the annuity has to be based off of your life expectancy. So generally, because of all these and because they gain such a small amount of interest, a lot of financial advisors don't like to purchase these annuities for people because they don't really make any money off of them. And it's also a huge liability. So our office works with a couple of different groups that provide these annuities, a couple of different brokers. We work through them. There's really only a select amount of people that offer these types of annuities.
And I'm going to read these last two questions, but we do need to move on to allow time for our last part of this discussion. So Caitlin, we have two questions and then we're going to have to move on. The first one is, if someone is single and low income, what does a Medicaid application cost from Rothkopf?
Really varies. I can't quote a fee on this, But a lot of times, when you call our office, you speak with Jacinda, who was on here earlier, or you speak with another client services director. They're able to give you a general idea of what the cost will be. But it really depends on circumstances. It depends on what kind of services you need. So I would definitely say call our office for that one. I can't quote prices.
Well said, Caitlin. And last question is, do you have to pay down before applying for Medicaid?
Yes. So generally, if you're a single person and these are the numbers we were looking at earlier, but if you're a single person in New Jersey, you can't have more than $2,000 and qualify for Medicaid. If you're a single person in Pennsylvania, you can't have more than either that 2,400 or that 8,000 that we were talking about and apply for Medicaid. And most people do have to spend some assets to get there. If you're a married couple, that's where this maximum and minimum CESRA come in, the Community Spouse Resource Allowances. This is how much you need to spend down to in order to qualify for Medicaid as a married couple. Prior to applying, both spouses' assets are countable. So they're going to look at that total. They're going to divide it 50%. 50% has to be spent or dealt with somehow. And the other 50% can be kept up to that minimum and maximum that we talked about earlier.
Thank you. Okay, guys, we are going to have Caitlin move on to veterans benefits. Just so that way we can allow time for Q&A at the end.
Okay, thank you. So next up is veterans benefits. The veterans benefit that we apply for most often is going to be the VA pension. So the veterans pension is a pension that pays out monthly, and there are maximum numbers that you can receive, maximum amounts you can receive monthly that we'll go over. So I'm going to pull these all up right now so you can take a look. So this pension that we're talking about, all of these amounts that you're seeing here are the maximum amount you can receive with aid and attendance included. So aid and attendance is an add-on to the base veterans pension. Aid and attendance means that the applicant or their spouse has a clinical need for a protective environment, and they require assistance with activities of daily living. So if both of these things apply, they can generally get the maximum amount because this includes that aid and attendance amount. This pension benefit, are for people generally who are 65 and older and who have had 90 consecutive days of service in the military with at least one day during wartime. The first amount that you're seeing here is for a single veteran, someone who is unmarried. The second number, the $22.95 a month, is the maximum that a married veteran can receive whose spouse is still living. Something to keep in mind when you're applying for a married couple is that the applicant, the veteran does not have to be the ill spouse. So if the veteran is healthy, but their spouse is dependent on them because they require care, those spouses, that non-veteran spouse's care costs do count towards the allowance. So the VA will take that non-veteran's care costs into account when determining whether or not they're eligible for this program. Survivor's pension, this is inclusive of a spouse who has survived their veteran spouse, and also a dependent child as well can receive this benefit. The last number on this list is the net worth threshold. I'm sure you guys have heard too much about this already. In October 2018, the VA changed a lot of their rules and regulations, but one of the big things that they added was they created a bright line asset limit. So it used to be you kind of submitted an application and hoped that your assets were where they needed to be. Now they're very specific every year. It goes up with the cost of living. So you can generally tell by just one glance whether or not you're eligible for veterans benefits. Something else to keep in mind here when looking at this net worth threshold, something that the VA does is they take not only your total assets, but they also take your total income, your monthly income, they multiply that by 12 and they add it to your total assets. So if you are close to this $130,000 threshold, you don't have a lot of care costs to reduce that number. You want to pay close attention and you want to add in your income. And this is inclusive of like RMDs, it's inclusive of interest, and it's inclusive of dividends as well. So all of those things count towards this total net worth. This total net worth can be reduced if you have consistent monthly care costs, such as assisted living expenses, such as health insurance, things like that. If you have consistent monthly care costs, you can reduce your net worth that way as well. But just keep that in mind when you're doing this calculation. Okay, so some changes we've seen this year to the VA when we're submitting applications. The first big change that's happened in 2021 is in application submission. Our office's primary method of submitting applications used to be via fax, and I know a lot of people did it this way as well, because you receive, paper proof pretty much immediately that your fax went through. The VA has received your application and they're processing it. They stopped accepting fax applications at the end of January. So now your choices are a couple of different online portals that are offered, and also mail-in. If you're a VisPro subscriber, which our office subscribes to VisPro, they have their own portal. I haven't had the chance to use it yet. I'm actually going to use it later today. So I'll let you guys know how it goes. The VA themselves has their own portals on their website. They are generally for one-off applications. So you can't create an account on va.gov and submit multiple applications that way. So it's not really ideal for our office or for someone who's trying to submit multiple applications. But if you're a veteran or a spouse of a veteran that's applying for yourself or your spouse, you can do that on va.gov. We also send a lot of our applications and documents via mail. Just make sure that you track it. I know that sounds obvious, but the VA loses everything all of the time. So if you ever want to see your paperwork again, make sure you track it. They'll say they never got it. Status updates. So it's part of our office's process that we call the VA every quarter, check up on our applications, see where they stand. They will know. It used to be they would quote us a completion date. They would tell us exactly what stage they're at in processing, but they will no longer quote a completion date. In addition, when you call, just something to keep in mind, you're not actually talking to the person processing your application. You're not actually talking to the adjudicator. You're talking to someone who's just answering the phone. So they have access to the computer system and they can say, okay, it's in this stage, but what does that mean? When will it be done? They can't give you any of that information. And then last thing on this list is going to be processing times. We have seen an overall slower processing time, I would say, since the beginning of COVID, since the government shutdowns. The veterans applications go a little bit faster. Their survivors applications are taking a very long time because as part of the survivor application process, the VA screens every single application for all applicable benefits. So they are going to check this person for DIC as well, dependency and indemnity compensation. And in order to make this check, they rely on the National Archives. And the National Archives are currently closed and only operating on an emergency basis. So it can take a lot longer to get a survivor's application through. And if you don't have your discharge paperwork that you need to submit with your application, you can no longer get it from the National Archives until they reopen. So the VA can get it for you. It just takes longer. And that is the end of our public benefits presentation. We can have a little more time for questions right now, Laura. Is that what you want to do?
Yes, please. I know that we are at our last 6 minutes of this call. We do have a couple of questions that have come in while you presented. One was, what makes a veteran eligible for the VA pension?
So the VA pension it's for people who are age 65 and older, who had at least 90 days of consecutive military service, and one of those days needs to be during a wartime.
Okay. And then the next question is, if you are getting VA benefits and need to apply for Medicaid, what happens to the VA benefit?
So it really depends on the circumstance. If you are receiving VA benefits and you are applying for Medicaid in a home-based setting or in an assisted living setting, you continue to receive that income. If you are in a nursing home, your VA benefit automatically drops to $90 a month. And this can be advantageous for some people. Both states allow you to keep that $90 instead of your personal needs allowance. So if you're in a nursing home and you're receiving, $45, $50 a month, we've now bumped up what you can keep to that $90. So we do a lot of $90 applications for our clients just to get them a little bit more to work with each month.
Thank you. What if a vet exceeds the net worth threshold once their application has been approved and they are receiving benefits? How is this monitored? Do their benefits have to be renewed each year?
So generally, it is not monitored. I have not had any clients this has actually happened to, because most of my clients that I'm doing these applications for do have a lot of care costs. I mean, one of the big factors in this, like I said, is reducing those assets using care costs to ensure that you get the full benefit. So people that are receiving the full benefit generally have significant care costs, and they're not accumulating large amounts every month in their bank account. And the VA, no, there's no recertification process. If you're determined by the VA that you need a VA fiduciary or someone to manage your funds for you, there is an annual recertification for the fiduciary representative to make sure that they're doing their job and they're managing your funds properly. So that's really the only check that the VA does every year.
Is the pension eligibility due to a medical issue from serving?
So there is also there are other types of benefits from the VA for people who were injured during their service. So those are going to be VA compensation claims. Our office doesn't do a ton of those. Once in a while we'll do one. I'm saying once every year. And those are for people who have a disability rating from the VA due to a service-connected issue.
How do you determine what is wartime? For example, my husband was in the military from 1958 until 1961.
Mm-hmm. There's an inclusive list on the VA's website if you just go to va.gov. I even pull that up sometimes if I'm worried that someone is on the edge of wartime. Generally, most of our applicants are going to be Vietnam, Korean War, Gulf War, and the Gulf War went on for years and years and years. I believe we're almost still in it, the time period. So it's very inclusive. So take a look on va.gov and double check your dates.
Does reserves count?
Reserves counts if you were called up to active duty. So that's a situation where you want to check your all of your documentation to see if the person was called up to active duty ever as a reserves member.
And lastly, can surviving spouses apply for any pension benefit after being located to skilled nursing?
Yeah, we do. Like I said, we do a lot of survivors applications. We do a lot of veterans applications. They're just only going to be approved if they're in skilled nursing on Medicaid. They're only going to get that $90. But if they're in skilled nursing, not on Medicaid, they'll qualify for the maximum benefit, because that skilled nursing is going to be a very high monthly care cost that the VA is going to account for.
Okay, and I will read this last question that just came in, and then we're going to have to close up this meeting to stay on our time. My husband is a vet, is disabled, and I am his primary caregiver. Is he eligible for a VA pension?
Yeah, as long as he meets all of the qualifications that we talked about, if he's over 65, if he's, if he had that 1 day of service during wartime, then he should qualify. And if you're under that 130,000 asset limit, then yes.
Thank you, Caitlin. So everyone, we will be sending the recording of this presentation out to all of those who have registered. So we do appreciate your questions. We appreciate Caitlin's time and her experience. Rothkopf Law Group is happy to offer this Focus on the Facts series. Our next one coming up, Donna, correct me if I'm wrong, is in June. And I believe we are talking about the evolution of the industry. Please, use us as a resource, reach out to us. We did share Caitlin's contact information and our office information in the chat. My colleague will do so again, just so that way you guys can grab it with ease. If you haven't yet done so, please like us on Facebook and LinkedIn. We try to use those social media platforms as a way to spread resource information. Caitlin often does blogs for us, giving up-to-date facts and material that you should know about, as well as other members of our team. So please take a chance, take a look at our Facebook and LinkedIn, and give us a follow so that you can continue to gain resource from us. And then lastly, when you sign up for our events, for example, this event, a couple of the registrants unsubscribed, so we were unable to send the connective link to them. So please don't unsubscribe from us until you attend our event. You can always unsubscribe or opt out at a later date. And last thing, we do always try to keep our calendar of events updated on rothkopflaw.com/events. So if you liked this event and you would like to learn more or like to see what other kinds of things are available to you, please take advantage of that calendar of events to learn more. Lastly, we do want to bring to your attention that we are hosting a virtual symposium. This is going to be open to professionals of the senior living industry as well as the general public. A lot more details will be shared in coming soon, but for now, we just wanted to get it on your radar, have you save the date, and also share the link so that way as we make further announcements, you can stay up to date on what the symposium is going to entail. Thank you everybody again for your time and for your participation. We hope to see you all on June 16th for What Happens Now, the changes in long-term care. Thank you everyone and have a great day.